Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Shahlla Kamal, working as consultant gynecologist in Tertiary Care Hospital. Today, I'm going to demonstrate a very important skill of ESM-UBT. ESM-UBT is the every second matters uterine balloon tamponade that is used for control of bleeding in the postpartum hemorrhage. So, what is postpartum hemorrhage? Postpartum hemorrhage is excessive blood loss after the delivery, around 500 ml in the normal vagina, more than 500 ml in the normal vaginal delivery, and more than 1000 ml in the cesarean section is labeled as PPH. PPH is of two types, primary PPH and secondary PPH. Primary PPH, when the PPH occurs within 24 hours, is the primary PPH, and if the postpartum hemorrhage is occurring within the 12 weeks, is called the secondary PPH. So, this balloon tamponade ESM-UBT is very beneficial for primary PPH. Nowadays, a PPH bundle approach is used. That is the bundle care, which consists of immediate first emergency response bundle, along with that of intervention for the refractory PPH, and along with these two, there are the two supportive measures. What could be in the immediate when you are going to deliver a patient and the baby is delivered? So you every unit has a protocol of active management of third stage of labor. Active management of third stage of labor is done to prevent the postpartum hemorrhage. If there is still bleeding after the active management of active management of third stage of labor, you have to go for this PPH bundle approach. This PPH bundle approach starts from call for help. In the first response bundle, you have to do the uterine massage, give the IV fluids, uterotonics, and tranexamic acid. Along with that, there are the certain supportive measures. Three supportive measures are empty the bladder, empty the uterus through MVA, manual vacuum aspiration, as well as if there is any tear, then stitch the tear. After all these measures, if there is still bleeding, you have to go for intervention for refractory PPH. What are the intervention for refractory PPH is bimanual compression of the uterus, as well as aortic compression, anti-shock garments, and this ESM-UBT. This is one of the component of PPH bundle approach when there is intervention for refractory PPH. So ESM-UBT is very effective, low cost, FDA approved device which can be used in these low middle income countries, and that can be assembled, placed and removed easily. So there are the why this is what is the principle of this ESM-UBT? The principle of ESM-UBT is it will create the tamponade on the uterine walls, so the bleeding of the postpartum hemorrhage can be controlled. And what could be the indication? Indication would be the primary PPH, that is the bleeding occurring within 24 hours of the delivery, and there is a uterine atony, and there is no other cause like coagulopathy or the tears, and all the pharmacological intervention has been failed, then this ESM-UBT can be considered. As I have already told you in the PPH bundle approach. What could be the prerequisite? As I have already mentioned, there are the five prerequisites. There should be the uterine atony, no coagulopathy, no tear. There should be adequate light, bladder should be empty, patient should be in the lithotomy position, and after explaining all the pros and cons, informed consent should be taken. What could be the contraindication of ESM-UBT? The contraindication would be pregnancy. If there is any advanced cervical cancer, if there is the next third contraindication is if there is a prevalent vaginal discharge from the vagina or the cervix, fibroid uterus, or any uterine anomaly that is causing the uterine distortion and has a difficulty in placement of ESM-UBT, and there is a uterine rupture. So these are the four contraindications that should not be considered. Or you have to be very careful when you are placing. There should be no excessive force should be applied when you are placing this ESM-UBT. There are the certain warning signs. There are the certain things which you have to consider while you are doing this ESM-UBT. Number one, this device is only for the single use. This can't be used multiple. The one device can't be used for the multiple times. Number one. Number two, this device shouldn't delay any critical event management, any critical intervention for the prevention, for the control of postpartum hemorrhage. Only 15 ml is used, 15 ml of normal saline is used to inflate the balloon of the Foley's catheter 500 ml, not more than 15 ml. 500 ml of the normal saline is used to inflate the balloon catheter. That is the maximum limit of this balloon catheter to prevent the bleeding, to create the tamponade effect. There should be used only the sterile normal saline, no carbon dioxide or no other things for the inflation of the balloon should be used. And if there, you have to monitor carefully for the signs of for the bleeding, so that if there is a DIC or there is aggressive management is required, that can be done along with that. Police catheter should be placed there to monitor the bleeding of the police catheter to monitor the output of the patient. There are the four components. Four components, like number one is the setting the trolley for the ESM-UBT, then assembling the device. Third is the placement. Fourth is the removal. After that, you have to do the documentation and the post-op monitoring. So first of all, I will go for what the trolley of the ESM-UBT or the tray of the ESM-UBT should have. Number one, you have two surgical gloves, 16 French gauge Foley's catheter, 60 cc syringe, Sims speculum, sponge holding forceps, silk number one to tie the condom over the Foley's catheter, and there should be an artery or a clip, a baby cord clamp clip, to hold this catheter to prevent from flowing of the normal saline out of the balloon tamponade. And these are the two condoms. Ideally, there should be the two spirit swab as well to control to like to give the antiseptic to this balloon tamponade. Now I will, this is the all the this is all about how you can, this is all about the setting the tray. Now how you will assemble the catheter. For assembling, you have to put on the gloves, or there should be there there should be, stop here, stop करो इसको. After putting the gloves, you have to take the 60 cc syringe and take the normal saline around 15 ml, so that is around 15 ml. I have take the normal saline. I will take the balloon catheter, police catheter, and will attach this syringe with the. After that, first of all, you have to fill up the syringe with the it's a 10 ml syringe. You have to take the 15 ml actually to inflate the balloon. So I will just attach this syringe with this. So now this water that should be used 15 ml and used to inflate the this balloon, that it shouldn't be came out. The catheter should be placed in, should be remain in the uterus. Now I will go for this balloon tamponade. This is the condom. You have to, it will be a little bit tricky. So you have to place the tip of the police catheter halfway between the condom, and take the one silk number one to tie the, because these are all the things which are easily available in your labor rooms, in your even if you are in the some BHU or uh, some RHC, you can have all these things there. So you have to place this balloon catheter, this catheter halfway between the condom, and tie this catheter along with that of silk number one at 3 to 4 centimeter below the tip. If I can show you people, here is the halfway. There should be some assistance when you are doing, because this assistance is required for that. So you have to try. 3 to 4 centimeter below the tip. So you can see here I have tied with the silk number 1. It will be little tricky. So after that you can cut, and this is the way you can assemble the balloon catheter or ESM-UBT you can make. I have made this balloon tamponade ESM-UBT. Now it's time to place. How you will you place? You need a sim speculum and a sponge holding forceps. So this is the model. You have to I'm just showing you for the purpose of demonstration. You have to put the sim speculum to retract the posterior vaginal wall and hold the sim speculum anterior lip of the cervix with sim speculum. If these things are not available, even without that, you can also do this ESM UBT. So I'm going to place this ESM UBT without these instruments. How you can do it? Well, we have to make the trolley here. As I have told you, you have to place the two fingers of your left hand in the cervix, because at the time of the delivery, the cervix is open because baby has delivered and the cervix is fully dilated. You have to place the two fingers of your left hand and hold the balloon tamponade in the right hand. With the guide, you have to hold from the Foley's catheter, from the hair, not from the balloon. You have to introduce with the guiding fingers of your left hand and introduce inside the uterine cavity. So it should be touch the fundus. Now you have touched the fundus. First of all, that 15 mcc of the normal saline to inflate the, but your finger should be here to inflate the balloon, so that you can see the balloon is inflated. Now it's time you have the artery or the baby cord clamp to hold this to hold the Foley's catheter, so that the normal sand which we are going to infuse inside the balloon tamponade to create the tamponade effect. What we will do, we will take the 50 mcc syringe and fill up with the normal saline. There should be an assistance, so that, or you can also use the one